Welcome to Death and Dying training from Wyoming State Hospital and the Wyoming Life Resource Center. The objectives for this training include providing support for patients, family, and/or significant other, keeping ethnic backgrounds in mind, encouraging use of spiritual resources, understanding the steps of the grieving process, encouraging expression of feelings, including reality-based conversations. Do not support denial. Follow the policies and procedures entitled Death of a Patient, and follow the policies and procedures for dispositions of patients' belongings to guardians or family. Knowledge of documentation to complete and the given time period for each item. It is a hard time for the family. Show that you care by being available, courteous, and considerate. You may find it hard to find comforting words. Use touch to show your concern. However, remember, touch doesn't mean the same thing for every culture. So make sure that you watch for facial cues and body language to see if it is appropriate or not. Respect the right for privacy. However, do not neglect cares. How make the family feel as comfortable as possible. Now here at Wyoming State Hospital, if somebody is actively dying, we would probably send them out to ERH. However, if they needed to have visitors, they would not be able to be on the units for extended periods of time due to safety issues. So it would be dealt with by the DON on a case-by-case basis. The family goes through stages like the dying person does. They need support, understanding, courtesy, and respect. A spiritual leader may provide comfort. Make sure that if your patient or a family member communicates a request for a spiritual leader, that you communicate that to the nurse. Experiences, culture, religion, and age influence attitudes about death. Attitudes about death often change as a person grows older and with changing circumstances. Practices and attitudes about death differ among cultures. In some cultures, dying people are cared for at home by the family. Some families prepare the body for burial. So make sure that you're not preparing and doing the postmortem care before you find out what the family wants and what the dying patient would want upon their death. Many adults and children never have had contact with dying persons. They may have not seen the process of death or dying, and they may be frightened, and it may be morbid to them and a mystery to them. As older people may have seen death a lot more. So remember, there's going to be changing attitudes based on age groups and what is going on. Spiritual needs related to human spirit and to religion and religious beliefs. Attitudes about death are closely related to religion. Many people are strengthened by their religious beliefs when dying. Religion provides comfort for the dying person and the family. Many religions practice rites and rituals during the dying process and at the time of death. Prayers, blessings, spiritual readings, and religious music are common sources of comfort, as well as visits from a minister, priest, rabbi, or a clergyman. Some believe in an afterlife, others do not. There are religious beliefs about the body form after death. Some believe that the body keeps its physical form. Others believe only the spirit or soul is present in the afterlife. Reincarnation is a belief that the spirit or soul is reborn to another human body or in another form of life. Comfort involves mental, physical, emotional, and spiritual needs. Comfort goals are to prevent or relieve suffering to the extent possible. Respect and follow end-of-life wishes. Comfort is a basic part of end-of-life care. Dying persons may want family and friends present. They may want to talk about their fears, their worries, and their anxiety. Some want to be alone. Often they need to talk during the night. You do not need to say anything. Being there for a person is what counts. Silence, along with touch, appropriate touch, is a powerful and meaningful way to communicate. Let them express their feelings and listen. Some people may want to see a spiritual leader. Some want to take part in religious practices. Provide privacy during prayer and spiritual moments. Always keep in mind safety and be courteous to the spiritual leader. Handle religious objects with care and respect. The stages of dying, according to Dr. Kubler-Ross, describe 5 stages of dying. I'm sure you've heard of these stages before. First is denial. Second is anger. Third is bargaining. Fourth is depression. And fifth is acceptance. Not all patients go through these stages at the same time, or family members. Some can go from denial to bargaining to acceptance. Some may go to denial and be stuck in denial. Some may go straight to anger and then to depression and be stuck in depression. It is based on the individual in what order and how these occur. The stages of dying are also known as the stages of grief. Grief is the person's response to loss. Some people are still in denial when they are dying. Anger is normal and healthy. Do not take the person's anger personally. Often the person bargaining with God or a higher power for more time. Bargaining is usually private and spiritual. The person mourns things that were lost in the future loss of life. The person may cry or say very little. Reaching the acceptance stage does not mean that death is near. A person may never get beyond a certain stage. Some people stay in one stage. Dying persons do not always pass through all of these stages the same, as we talked about just moments ago. Remember that they may move back and forth and they may be stuck. And we want for them to be able to get to acceptance, but some may never get to acceptance. End-of-life care describes the support and care given during the time surrounding death. Death may be sudden or expected. Some people gradually fail. End-of-life care may involve days, weeks, or even months. You must understand the dying process. Then you can approach the dying person with caring, kindness, and respect. The healthcare team sees death pretty often. Many team members are not sure of their feelings about death. Your feelings about death affect the care that you give. You will help meet the dying person's physical, psychological, social, and spiritual needs. Care of the body after death is called post-mortem care. A nurse gives post-mortem care. You may be asked to assist. Post-mortem care begins when the doctor pronounces the person dead. Post-mortem care is done to maintain a good appearance of the body. Discoloration and skin damage are prevented. Valuables and personal items are gathered. Every person has the right to privacy and the right to be treated with dignity and respect, even after death. Within 2 to 4 hours after death, rigor mortis sets in. The stiffness or rigidity of skeletal muscles that occurs after death is what rigor mortis is. The body is positioned in normal alignment before rigor mortis sets in. In some agencies, the body is prepared only for viewing by the family. The funeral director completes post-mortem care. The coroner or the medical examiner can order an autopsy, or the family can request one. This is in the case of most facilities. After these first set of slides, we're going to go through our policies and procedures and what is expected here while you are working here. When an autopsy is done, postmortem care is not done. An autopsy is the examination of the body after death. Follow agency procedures for an autopsy. Moving the body can cause remaining air in the lungs, stomach, and intestines to expel. When air is expelled, sounds are produced. They are normal and expected. All right, let's talk about Wyoming State Hospital's policies and also the policies for our partner facility. Okay, understand all circumstances of patient's death in the report that will be made immediately to the hospital administrator and law enforcement authorities, who shall in turn notify the Uinta County coroner. According to state law, a physician must pronounce the individual dead. The physician must come to the location of the body, examine the patient, and make the pronouncement. It is the right of an individual to have the option of organ or tissue donation at the time of his or her death. Federal law requires that hospitals adopt organ and tissue donation protocols as a condition of participation in the Medicare and Medicaid programs under Section 1138 of the Federal Social Security Act. All patients' deaths at Wyoming State Hospital are considered coroner cases, irrespective of the cause of death. Upon observation of a patient's death or apparent death, note the exact time the patient was found without vital signs or when the patient ceased to breathe. The nurse will notify the attending LIP or another LIP, local law enforcement authorities, and hospital safety immediately. In the case of suspected homicide, suicide, or violent criminal action, the body of the deceased is not to be moved from the place of death until the coroner has viewed the body. The Uinta County coroner is also the community's mortician. Standard precautions are to be maintained at all times. If radioactive material is within the body, indication to the same must be made. The LIP will write a note to the progress notes and an order that the body can be released to the coroner or mortuary. Before the body is released to the mortician, a form needs to be filled out for consent for removal of body. This must be completely filled out by the nurse. 2 copies are required. Send 1 copy with the mortician or coroner and keep the original with the service record. Hall nursing staff shall document in the progress notes the time the body left the hospital. All staff involved in any facet of an incident immediately preceding or involving a death are required to complete a progress note and incident report. Let me repeat that because it's important for you to understand. All staff involved in any facet of an incident immediately preceding or involving a death are required to complete a progress note and incident report. The LIP or designee will notify the deceased family, guardian, and the following: the hospital administrator, medical director, local law enforcement, the city police, hospital safety, communications center, the chaplain, the director of nursing services, the clinical director, and risk management. The cause of death will be communicated only if there is clear evidence of the cause. Collect inventory and store in a secure area all of the deceased's clothing, and other personal belongings. This inventory will be conducted by 2 staff members assigned by the unit manager or the nurse manager. The inventory list will be maintained in the business office until proper disposition of the items have been accomplished. A sentinel event, which is an unanticipated event in a healthcare setting resulting in death or serious physical or psychological injury to the patient. So a sentinel event investigation will be conducted with regards to the circumstances of the death of any patient at these hospitals. The hospital administrator or designee will verbally notify the Department of Health Director, the Office of Health Quality, Regional Center for Medicaid and Medicare Services, CARF, the Department of Family Services, if applicable, and Protection and Advocacy Incorporated of the Sentinel event. If the LIP requests an autopsy, it can only be done with proper consent. The medical staff member must obtain permission from the family guardian as follows. The call to the family or guardian must be monitored to witness information. The family or guardian is asked to send an email or fax stating permission granted for complete autopsy. If the family guardian is present, they are to sign a permission for autopsy form. There should be 3 copies signed. Distribution of the autopsy is as follows. The original to the medical staff member, 1 copy to the service record, and 1 copy sent with the body. Provisional autonomic diagnosis shall be recorded in the service record within 48 hours, and the completed protocol should be made a part of the service record within 90 days. When an LIP requests consent for an autopsy from the family or guardian, the pathologist will notify the LIP of the time and date of the scheduled autopsy immediately or at the earliest practical time. When the pathologist schedules the autopsy, he shall notify the LIP of the exact date and time. The Uintah County Attorney may mandate an autopsy if abuse is suspected. Upon complete recommendation of the coroner or hospital staff, if the medical staff member determines an autopsy, it is not indicated by the family that they wish an autopsy, the expense of the procedure will be incurred by the family. So again, if the medical staff member determines an autopsy is not indicated by the family wishes, but the family wishes an autopsy, then the expense will go to the family. Authorization for organ and tissue donation. Persons permitted to sign authorization for donation are the same as for any major hospital procedure involving consent. They are listed in order of priority. Legal guardian in conjunction with the next person below when appropriate. Spouse, adult child, parent, adult brother or sister, another person authorized to disposition of the deceased. Medical examiner, any death that falls into the purview of the medical examiner or coroner will be reported to the IDS. The recovery coordinator will make direct contact with the medical examiner for donation assessment. The responding medical staff member is to notify Intermountain Donor Services, which is at 1-800-833-6667 regarding organ tissue donation, and also contact Utah Lions Eye Bank at 1-801-581-2039 regarding ocular eye tissue donation. Organ procurement officer, the medical director will serve as the organ procurement officer for the Wyoming State Hospital. Organ donation cannot occur at Wyoming State Hospital because no mechanical ventilators or determination of brain death can occur. So the only things that they can donate is tissue and ocular eye tissue. Tissue donation can occur based on the above criteria only. Okay, now all of this information having to do with policies and procedures, I just want to go out of this PowerPoint and show you where you can locate it at any time on your computer. So make sure you follow your policies and procedures, because remember, you work for these hospitals, and you need to be able to know what your policies and procedures are to protect yourself in the case of something occurring. Okay, so first of all, you would go right here on, right into the internet and go to the intranet. You'll have a world right here. Mine is not showing for some reason today. When you double click on it, it will open up. Sometimes very slowly. And then as you go into this, you can go right up here to the policies. Wyoming State Hospital policies, and this will give you a listing of all of the policies. Or you can go to your little file folder down here at the bottom and go into your G drive, go to halls, go to common, and then go to policies. And then you can see all of the policies within here. There's a whole list under hospital policies. And if you want to go here for a search, and let's say you're going to go to the death and dying one, you would go to death. And right here, death of a patient comes right up. And you'll want to go to the most current policy. Make sure you follow the policy and double click on it, and it will open up that policy, and you'll be able to read through the policy, which is the information that you received today. Okay, thank you for coming to this training. When it is finished, you will do an assessment. After the assessment, you will be able to print off a certificate with contact hours. And make sure that you fill out the evaluation at the end.